Figure 12.1. The approach to the patient. Determining if the patient appears lifeless or if the patient has signs of life. Approach to the patient. Check for responsiveness. Perform a quick scan of the chest and breathing. If the patient appears lifeless or pulseless, unresponsive, not breathing, or ineffective, agonal or gasping breaths, versus signs of life / pulse, responsiveness, or breathing. The primary assessment is generally considered to have 6 parts. See the visual guide to primary assessment. Forming a general impression. Assessing the patient's mental status and stabilizing the patient's head and neck when appropriate. Assessing the patient's airway. Assessing the patient's breathing. Assessing the patient's circulation, and determining the patient's priority. Note, if during the primary assessment you discover any life-threatening condition, you must immediately perform the appropriate interventions or actions to correct those problems. Form a general impression. Forming a general impression helps you to determine how serious the patient's condition is to set priorities for care and transport. It is based on your immediate assessment of the environment and the patient's chief complaint and appearance. The environment can provide a great deal of information about the patient. It frequently offers clues to the EMT who looks for them about the patient's condition and history. One of the most important things the environment can sometimes tell you is what happened. Figure 12.2. Forming a general impression includes your immediate assessment of the patient's environment and the patient's chief complaint and appearance.